Hey everybody, are we on? Hey, so it's Dr. Kave here. I'm so excited to talk about high functioning anxiety and why my patients struggle so much with seeking help when they're struggling with serious anxiety, but the people around them just don't know what's affecting them. I don't know if you've ever heard of people who are really high achieving, socially outgoing, proactive, problem solving. You look at them from the outside and you would think that they're just crushing life and cruising through it. But deep down, they're actually suffering from the same physical and psychological symptoms of anxiety. I see it in my patients when they're on the operating room table, connected to the monitors under anesthesia. From the outside, you'd think that they're completely calm, in control of the situation, but their mind is actually going a million miles per hour. And it can be dangerous before you go under anesthesia, before medications like the white stuff or this medication here goes in because of the side effects that come when your body is unconscious from that high level of anxiety. Whether you're showing it or not, we can tell, and it affects your anesthesia and surgery. So I want to tell you about how anesthesia can not only reveal it, but can also help overcome that crazy anxiety, sometimes better than our traditional medications. And more importantly, even if we give you benzodiazepines like Xanax or Valium or Ativan before surgery, you can't take that home with you in a goodie bag. And being able to control your anxiety yourself instead of relying on benzodiazepines actually makes your recovery much smoother and safer when you go home, especially when you're taking other medications like opioids that can cause all sorts of real disastrous overdose deaths like I see in my patients in San Francisco. So let's get to it. And by the way, I'm looking at all your questions here on my computer, so feel free to ask more about about anxiety and what happens in the operating room. By the way, this is a real anesthesia machine with the monitors that connect to my patients before they fall asleep, and that's one of the first signs of somebody who is struggling from high anxiety, even if they're high functioning and are hiding it very well. So, Caitlin is asking the first question. I have bad anxiety. When I get surgery, I normally end up getting midazolam. Last time I didn't want it, and I feel like it helped me not I felt like it helped not getting it, or I had more control, or whatever. You're completely right, Caitlin. So many of my patients actually don't want to get midazolam or Versed because of the lack of control that they have, and a lack of control can actually increase anxiety. So, you nailed it, Caitlin. You pretty much answered everything here that patients ask, right? Why do some patients have what we call paradoxical reactions to benzodiazepines, where the common medication actually makes them more anxious because of what you just said? When we lose control, even if we outwardly maintain our composure and our high functioning, high achieving, whatever, that lack of control or fear that we're going to lose control, even if it's from medications, can make some of us feel worse. That's why so many of my patients are afraid of general anesthesia in the first place, which of course can start the whole anxiety loop. So great. Well, a whole bunch of questions coming in. Vivian, I had to get a shunt placed because of a blockage in the venous part of my brain. Is it super dangerous? It can be, depending on how big the blockage is. I'm rooting for you. I hope everyone else watching is rooting for you as well. If you have any questions about the anesthesia, you want to talk to your anesthesiologist. Depending on where that shunt is going to be placed, it's usually under general anesthesia. Okay, so here's the big question. How does anesthesia help you overcome that high functioning anxiety or even general anxiety disorder? So the best example that I heard recently is that imagine you're skiing down a slope and you see a whole bunch of tracks in the snow. Better yet, imagine you're cross-country skiing and you see all these really well etched out grooves and you're cross-country skiing in them. It's hard to not ski in them, right? So if you're skiing in an anxiety loop, a TBR loop, where it's like trigger, behavior, reward, so you're just being conditioned to feel anxious all the time, your brain is always going in the same loop of amping itself up. It's really hard to get yourself out of that loop. Like if you're skiing, it's hard to make new tracks. What anesthesia can do is give you a new snowfall so that all of those tracks get covered up allowing you to make new tracks. And when you make new tracks, guided by somebody who knows what they're doing, like your physician, your doctor, they can help you re-etch more healthy, less anxiety-provoking habit loops, new brain circuits for you to literally start living your life through. When we say neuroplasticity, that's where so much of it comes from. It's not necessarily us or the medication doing it as much as you doing it, facilitated by the medication or by us. I always tell my patients that, to be honest, I'm not fixing your problems. You are tapping into your inner healing potential to solve your own issues and heal yourself, augmented by me with the medication, helping you just discover what you've had all along. That's the inner healing potential that all my patients have, whether they're on the operating room table, connected to the monitors or not, doesn't matter. You all have it. It's just a matter of having the wheels greased to let your inner healing potential come out. So let's catch up on questions here, and then I'm just going to give you another example of ways that you can totally hide your inner anxiety state. Remember, those symptoms are like high heart rate, tachycardia, high blood pressure, what we call hypertension, sweaty palms, dilated pupils. You can't hide too many of these. It's kind of hard. The pupils, sometimes you can tell if you look closely in somebody's eyes. If you can get them in the right moment when the anxiety kicks in, you'll see their pupils dilate. You can do it yourself if you look in the mirror and start to focus really hard on a stressful task. You can actually see your pupils slowly dilate. Maybe you record it, with your phone. That's one of the ones that's harder to hide. When we say high functioning anxiety, the pupils are kind of like the window to the soul. It's hard to hide that one. But a lot of the other symptoms can be very easily hidden. So high functioning anxiety has lots of good things as well, because for that moment you might be more productive, might be thinking faster. You're in a fighting response as opposed to a flight response. Generalized anxiety disorder is more of the flight response because you're socially avoidant, distance, and denial, etc. Can also be useful sometimes, but we think of the fighting response as being more helpful unless it goes on for a long time. Like imagine I'm monitoring you for 12 hours in the ICU, 24 hours in the ICU. Now you might begin to start slowly seeing the effects of chronic anxiety kicking in, chronic stress state, and that is the danger, even if it helped you in the short term. All right, questions. Oh my goodness, so many. Hey, I have a big fear of doctors, and I've been pushing off surgery for a while. Lucy Thompson, you're not alone. It's called white coat hypertension, actually. The response that can significantly raise your blood pressure. What you're doing now is super powerful because exposure therapy is one of the most powerful, safe, and oftentimes free ways of being able to slowly expose yourself to reduce the anxiety. When it's guided, it's even more effective. It's actually one of the ways that I help my patients at my clinic in San Francisco. Exposure, either psychologically or physically, with infusions of anesthesia going in to help them slowly, like I said earlier, make new etches in their brain of new loops that are less problematic, like anxiety loops, depression loops, PTSD enforcing loops, etc. Lone Star, how does unanticipated difficult intubation occur? Well, that's a tough one, right? When it happens, you got to have the LMA immediately available, and it depends on whether you can bag mask or not. That answer your question? If you're maskable, you have all the time in the world. It's when they're not maskable, so difficult ventilation and difficult intubation, that's when you have to go for the surgical airway fast. The adage for anesthesia, by the way, is not that anesthesiologists kill patients, it's waiting to intubate and trying to intubate is what kills patients. That makes sense. Okay. Worship Today Studios. Why do patients get emergency delirium or emergent delirium? Emergent delirium is the word. Hey, it's because of disinhibition of the frontal cortex, having pain from having surgery, an inflammatory response. All these things go together in the disinhibited state of anesthesia that causes us to then act out, be aggressive, say ridiculous things, be inconsolable, which is one of the definitions of emergent delirium, particularly problematic in children and elderly, so the geriatric population. Okay, Rona, so good to see you on here. Can you have delirium due to the meds used? Absolutely. Benzodiazepines are a classic inducer of emergence delirium, but so are all not only the propofol and the opioids, but even the anesthesia gases that you see here are all totally potent inducers of emergence delirium. Surgery soon for gallbladder removal. Maddie, I'm wishing you the best for your surgery. Check out the videos that I have on how to prepare. There's a lot of them. And ask more questions if you have any specific ones. I'll get to them here. I'll try to prioritize them. Chris, very good to see you on here. Vivian, tachycardia when waking up from anesthesia. What does that mean? It is simply a common response to your body going through stage 2 of anesthesia. When you're fully asleep, your sympathetic nervous system is relaxed. When you're waking up or going to sleep, your sympathetic nervous system actually goes nutsos, causes the tachycardia, the high blood pressure, lowering dose spasm risk, etc. It's actually much more potent in my experience in patients who use marijuana every day for reasons that we simply don't understand yet. But it's a very, very real phenomenon that anesthesiologists and emergency room physicians know about because it influences how we treat our patients. Maddie, hey Rona, thank you for advice to Maddie, that's fantastic. Carrie says, Grey's Anatomy scared me about having surgery. Does it really go like that in the OR? Absolutely not, promise. Barbara, hey, my name is Skippy. I have high anxiety, but you're in California, I'm in New Jersey. I would come out there. Well, Barbara, I would love to help you with what you're struggling with. I don't know if there's clinics in New Jersey that do that. Just so you guys know, Barbara's talking about my infusion therapy clinic in San Francisco. All the information is online. So much information free for you guys to learn about what it is like to go through that experience to ultimately tap into your healing potential. I strongly recommend anyone who's been struggling with medications for depression or anxiety, or the side effects from medications for depression or anxiety, to consider ways they can naturally heal themselves from these debilitating disorders if possible. It's not always possible, and sometimes those medications are super necessary and effective. But oftentimes there can be side effects that I always want to help my patients overcome when possible, and naturally at that. Okay. Sherry's having surgery early tomorrow morning. It's a 3-hour surgery. I'm wondering if once I'm asleep, will there be an issue because of my anxiety? Sherry, unlikely if you're having general anesthesia. The anxiety is mostly for what happens when you waking up with more pain, more anxiety. It impacts your recovery, chances of infection, blood clots, etc. That's why getting your anxiety under control before can have such fantastic benefits. Guys, we need to, almost running out of time here. Such great questions. Exposure therapy has gone badly, says Lucy, because someone in my family died. Oh my gosh, I'm so sorry, Lucy. So this is why exposure therapy is so powerful with a guide. And when I do exposure therapy with my patients, it's with medication, either beta blockers, sub-anesthetic doses of anesthetics to help the brain not go into denial, defensive avoidance mode, but to slowly let it accept the exposure of the experience that's going on. That's why being guided through an experience with anesthesia can be so powerful. I'm wishing you the best, Lucy. Guys, great questions. Running out of time, but we'll get there. Intraoperative neurophysiologists. Hey, Logan, great to see you on here. Do they train us on the effect of anesthetic drugs on intraocular neuromuscular? Yeah, IONM. If by IONM you mean the effects of neuromonitoring for spine cases or brain surgery cases, yes, we are absolutely aware of those. I have to learn about them because we can't give, for example, paralyzing agents if you're trying to do motor responses to make sure that there's no broken neural connections during spine or brain surgery. So yes, we do learn about them. Okay, Brittany Anderson, great to see you on here, and thank you for the kind comments on the Day in the Life video. I'm having a couple other really exciting, fun videos I think you're going to appreciate. So stay tuned. A good undergrad major for a future anesthesiologist. Hey, I I am an engineer by training, so I did engineering. I always advocate for engineering for people that want to learn about how the world works around them. It's really powerful stuff. Lone Star, future videos on blood pressure stats. Which one in particular? Let me know, and I'm happy to do that. Pheochromocytoma surgery, guys. When we're talking about causes of anxiety, pheochromocytoma is actually one of the organic causes of anxiety. It's when a little mass that grows on your adrenal glands that can release all the stress hormones kind of unpredictably sometimes. Anesthesia for it is very, very peculiar because when those stress hormones are released, like during intubation or during surgery, we have to use very particular medications so we don't cause life-threatening increases in blood pressure, heart rate, etc. The most common technique is going to be to run a very deep anesthetic and have non-selective alpha and beta blocking agents. Ultimately, you want to avoid unopposed alpha. A little bit technical, we won't go into that right now, but you can look up the concern for unopposed alpha by using pure beta blockers in pheochromocytoma surgery. And yes, Logan, anesthesiologists are very, very sneaky, you're right. Hey, Brittany says, I'm gonna have another endoscopy next week. Bring on propofol and Versed. Propofol is overall much, much better than Versed, partly because of the risks of cognitive disorders, emergent delirium. In general, my patients don't like Versed nearly as much as propofol because, like we said, when you lose control, you can make anxiety worse in certain patients, especially those with high-functioning anxiety. Guys, I hope you all learned something. There's a lot more on this topic. We'll talk about it in future lives. But I just want you all to remember that high-functioning anxiety doesn't mean that you don't have real anxiety. It doesn't mean that you're not suffering on the inside, even though you look composed on the outside. I didn't connect myself to the monitors, but if I did, I could show you how I can control those numbers on there with my mind without you being able to tell. Only exception is going to be the pupillary dilation. That can give it away, but it's really subtle. You still suffer from the same side effects of chronic anxiety and chronic stress, no matter how well composed you are. And that's where my patients, when I see that happen under anesthesia, I try to work with them. If it's sedation, if they can hear me, sometimes even under general anesthesia, because parts of your brain are still active, to help them be able to reform new habit loops. Erase the old ones, like we talked about, because that's what anesthetic medications can do when used at sub-anesthetic doses, guided by a physician. Or I do it in my clinic in San Francisco so that patients can hopefully get off of the benzodiazepines, the SNRIs, etc. They do have side effects. And when we can get off of them and with just a handful of anesthetic infusions, be able to really help somebody rewrite their habit loops, rewrite their cognitive rigidity, those are the life-changing moments that I like to have with my patients inside and outside the operating room. So you have more power over your health than you've probably ever been told. And that's where the power of anesthesia or psychedelics can come in when used appropriately. High-functioning anxiety is just one of those examples. I hope you'll learn something about it. And you can definitely see my videos of when I've gone through panic attacks on myself, connected to the ventilator, the monitor, self-induced. You can see the changes that happen. And just ask yourself, wow, if that anesthesiologist can put his body through all that and look totally calm doing it just by how he breathes, how many people are walking around out there suffering from the long-term consequences of anxiety, unmanaged stress, maybe concomitant depression, but they don't let it on and they appear to be functioning just fine in society. My heart goes out to them because they might be less likely to reach out for help because no one's offering to help them out because they're acting perfectly fine. It's not saying it's their fault, but I'm saying that mental health has all sorts of different flavors. And under anesthesia, I'm privileged because I get to see what the body's really doing. We don't always get that privilege outside the operating room. So have compassion for your fellow humanity out there. You don't know what they're going through. I've been fooled so many times by people that I think are totally calm. They come into the operating room, they still say they're calm, connect them to the monitors, and they're on the verge of a panic attack. You know, it breaks my heart because it's like, you know, if you told me, I would have done maybe more. You know, I'm not perfect. I try to always treat everyone with the most, you know, the best way I can. But if they're telling me they're not anxious, it's harder for me to really go into that anti-anxiety mode. You know, it's just part of being human. I want to help you when I can. If you're my patient, it helps if you share with me what's going on. I know it's hard during surgery. I'm not blaming anyone, but the bottom line is having compassion for everyone around you. You really don't know. So with that said, I'll see you guys in the next live. I hope you all learned something. Remember that you have more power over your health than you've ever been told. Till next time. Are we not off yet? Oh. I don't know why this is not.